This is Parkinson's disease and auditory comprehension by Owen Zinn. The purpose of this presentation is to briefly outline the degenerative disorder Parkinson's disease, including its clinical features and diagnosis. This presentation focuses on the deficits in auditory comprehension often found in patients with Parkinson's disease. I will discuss proposed methods of treatment for auditory processing deficits, including medications, delayed auditory feedback, and predictable auditory cues, as well as compensatory strategies and caregiver education. Parkinson's disease is a common progressive disorder characterized by the slowed ability to start and continue movements. It can be accurately diagnosed, and the main risk factor is age. Another risk factor is genetics. Race is not a risk factor. The median age of onset is 60 years old, and the duration of the disease is usually around 15 years. Precise mode of death can be difficult to identify, but in many cases, pneumonia is the most common cause. It is reported to be more common in men. It's been reported that up to 1.5 times more likely in men than in women, but these numbers have fluctuated with different studies. The first case was described in 1817. For clinical features of Parkinson's disease, it commonly presents with impairment of dexterity or sometimes a dragging of one's foot. It has a gradual onset with early symptoms often unnoticed or misinterpreted for a time. Fatigue and stiffness are common, but there are also many nonspecific complaints that have been noted. Changes are rarely noticed by the patient, and early signs are often erroneously ascribed to old age, and a lag of up to 2 to 3 years from first symptoms to diagnosis is not unusual. A change in writing can be present, with a tendency to slope upward and for writing to get progressively smaller and more cramped as it progresses down the page. For diagnosing Parkinson's disease, bradykinetic is the slowed ability to start and continue movements and an impaired ability to adjust the body's position. Diagnosis of Parkinson's cannot be made without a detection of bradykinesia. Bradykinesia might be apparent when first meeting a patient, or maybe if you view them trying to undress for examination. Their facial expressions can be immobile and rigid, and the ability to express emotion slow. One way to diagnose bradykinesia is through a rapid repetitive finger tapping of the index finger to the thumb for 20 seconds. That's the most popular method. Bradykinesia in the leg can be assessed by foot tapping or walking. It is also the best clinical practice to assess a client's writing as well. As for auditory discrimination in people with Parkinson's, the dual stream theory presents the idea that speech perception is subserved by two dissociable pathways, a ventral stream and a dorsal stream. The ventral stream is composed of superior and middle temporal lobe structures, while the dorsal stream is believed to encompass regions of the left inferior frontal cortex, including Broca's area. Dual stream model can predict declines in coding and perceptual stimulation of speech sounds, and this can be seen in patients with Parkinson's. As for the literature review, in the article Tone Discrimination as a Window into Acoustic Perceptual Deficits in Parkinson's Disease, 12 people with Parkinson's and 15 age-matched controls made judgment on pairs of pure tones that were varied by acoustic features such as frequency, amplitude, and duration, as well as the perceptual distance of close versus far. Relative to the healthy age-matched controls, clients with Parkinson's showed marked impairment in tone discrimination. Parkinson's clients showed deficits in detecting frequency and amplitude as well. This supports the hypothesis that people suffering from Parkinson's have decreased sensitivity to changes in some acoustic features of speech. In the past, Parkinson's has not been commonly regarded lesion model for auditory deficits. Literature, however, is evolving, providing implication of regions of the frontal lobes in auditory perception. These further deficits from those that already come with aging leave people suffering from Parkinson's at a great disadvantage when it comes to speech perception. In the article, Dopaminergic Medication Alters Auditory Distractor Processing in Parkinson's Disease, there were 14 Parkinson's patients and 13 matched healthy controls. They completed an auditory oddball task. The task was performed by the Parkinson's patients twice, once on and off the medication. For the patients on Parkinson's, there was a significant difference on versus off the medication. The authors also suggest that the medication can help with processing of distracting auditory stimuli, such as cars in the background, a fan, a conversation happening elsewhere. In the article, The Effect of Dopaminergic Medication on Beat-Based Auditory Timing in Parkinson's Disease, participants again were tested on and off the medication. They did a rhythm discrimination task, and they had to choose if the rhythm was on or off the beat. As would be suspected, patients with Parkinson's perform worse than the control participants, and the authors suggested that the medication may improve their ability to tell if the rhythm is on or off the beat. Participants who were more severely affected by Parkinson's, which was viewed through a higher MDS-UP DRS score, did worse than those less affected, as you would suspect. Control participants also improved in their ability over the 2 sessions, whereas the patients with Parkinson's did not improve at all, suggesting that in addition to these timing deficits, they may be less able to learn from repetition, creating a further deficit for those afflicted. In the article, Vocal Responses to Perturbations in Voice Auditory Feedback in Individual with Parkinson's Disease, the purpose of the study was to view deficits in people with Parkinson's who show significantly reduced vocal loudness and pitch range. The study investigated if these abnormal vocal properties were related to sensory processing of auditory feedback. The patients with Parkinson's had a larger response to magnitudes when compared to healthy control groups to pitch and loudness. Supported the hypothesis that patients with Parkinson's differed in auditory processing on pitch and loudness. And they also suggested that the basal ganglia dysfunction may impair the integration of auditory feedback. People with Parkinson's also suffer in their perception of emotional speech. A study was conducted that had 14 Parkinson's patients and 14 healthy controls. They did a passive listening task and then had to detect if the person reading the passage was maybe happy or sad. And the patients with Parkinson's did a poor performance in classifying emotional prosody. My own thoughts on this area are regarding family and caregiver education. It would be upsetting to be a family member of a loved one who had Parkinson's and approach them with emotion in your voice and have it go undetected, and this could certainly result in a communication breakdown or error. I think it's important to educate family members or caregivers of someone who has Parkinson's that this person is not being insensitive to your emotions but can no longer detect these changes in speech that come with emotion, and that the family member or caregiver needs to be understanding of these changes that the person suffering from Parkinson's is going through, and not to take something like that personally if that were to happen. People with Parkinson's also show decreased ability to perceive vowels. In this study, there were 20 healthy listeners, 20 patients with Parkinson's. They did a single word target within a sentence. They had to identify the target vowel within those words. And the authors found that the front vowels were the most difficult for patients with Parkinson's to identify. Modifications of the fundamental frequency of vowels, such as flattening or enhancing the fundamental frequency, affected the accuracy of the vowel identification for those with Parkinson's, but it did not affect the identification ability of the healthy controls. For clinical implications, timing deficits in people with Parkinson's disease are thought to be related to the dopaminergic dysfunction in the basal ganglia. One study used predictable auditory cues, which have already shown results in assisting people with Parkinson's in their synchronous motor and temporal processing. This method also showed results in assisting in the processing of higher-level linguistic information. This method only worked with a cue of a march and did not work with the cue of a waltz. The authors of this study propose that stratocortical circuits in healthy brains synchronize internal oscillations with external events. The basal ganglia degeneration in people with Parkinson's can destabilize internal oscillations and affect computation of linguistic information. They showed that a person with Parkinson's can benefit from predictable, external, beat-based auditory cue that maps the structure of language. Another study used delay auditory feedback to increase the intelligibility and fluency of 3 patients with Parkinson's. The study found that a delay of 150 milliseconds yielded the best result. Therapy was then even more successful with the addition of clinician instruction. This study showed that delay auditory feedback and clinician instruction are both efficacious when treating auditory processing deficits in people with Parkinson's. More clinical implications focus on using compensatory strategies rather than on restoration of function. It is best to focus on and maximize and maintain the current communication functions for as long as possible. Patients can be taught to capitalize on their strengths, use context clues and pre-existing knowledge that can assist a patient in responding to questions. Caregivers need to be involved in treatment and can be taught to use direct statements rather than having a patient with Parkinson's have to make inferences. In summary, Parkinson's disease is a progressive degenerative disorder of the central nervous system. Parkinson's is often characterized by the movement difficulties exhibited by those afflicted. One often less considered symptom is deficits in the auditory comprehension, thought to be caused by basal ganglia degeneration. A variety of methods to treat these deficits exist. Explored in this presentation were studies that cited the efficacy of dopaminergic medication, delayed auditory feedback, compensatory strategies, caregiver involvement, and predictable auditory cues. Thank you for listening to this presentation.